Hi, this is Mark Adajar again, one of the docs at XSculpt, and I wanted to talk today about estrogen balance during testosterone replacement therapy. It's a question I get all the time, and I wanted to put this video out there so that if any of my patients or if anybody else out there wants to listen or be reminded about what we talk about in the office, you can refer to this video. So the main question is why does estrogen go up during testosterone replacement therapy? Well, the main reason is because we are optimizing your testosterone levels, and when we do that, your body has a certain enzyme which is mainly found in fat cells called aromatase, which converts your testosterone to estrogen. So as your testosterone goes up, the more testosterone that's available, you could convert some of that testosterone to estrogen. That's why it's important to monitor your estrogen levels, and that's why we do it routinely to make sure your estrogen levels don't rise. Now, what's bad about having a high estrogen? Several things can happen. You can have symptoms like decreased sex drive, you can have weak erections, you can become bloated and by retaining water, and you can have mood swings or even signs of depression when your estrogen is too high, and physically you can have gynecomastia develop, and you can get increased deposition of body fat. Now, that's the problem when estrogen is too high. So the question is always follows as well, why don't I get rid of my estrogen completely, which is also a bad idea because men do need estrogen, even just a little bit, for lots of reasons. Most importantly, it's for heart and bone health. If your estrogen is non-existent or zero, you put yourself at increased risk of developing heart attacks or what we call pathologic fractures from the density of your bone being very weak. Interestingly, also the symptoms of extremely low estrogen is very similar to the symptoms of your estrogen being too high. You can get sexual dysfunction, you can get mood swings, and stuff like depression. And then you can also develop water retention or bloating as well. There are a whole lot of other symptoms that come along with it, but in general, I think it's safe to say that it's important to have even just a little bit of estrogen in your system for health reasons, and so it's not good to not have any estrogen at all. So now the question is, actually the controversy is, what estrogen levels should men be at? There is no scientific evidence to determine what that number should be, based on a lot of experience of doctors. Just clinically, it can range. It is actually a wide range, but I have personally discovered a range from somewhere between 20 and 30 is ideal. Below 20, I'm a little bit nervous about, definitely not less than 15. But 20 and 30 in my experience has been a good range, and a lot of other physicians, if you're doing your research out there, also feel that somewhere around 20 is a good number for men. However, that being said, you have to be in tune with your body and try to notice some of these changes, because sometimes people function best at an estrogen of 15, sometimes people require an estrogen of 30 to feel right, so it might require some adjustment, and that can be a very difficult thing. But in general, around 20 to 30 is what I personally prefer people to be at, but it is a case-by-case basis. Now the question is how to get you to that estrogen range. And there are several ways to do it. You can do it naturally without any medications by weight loss, specifically reduction of fat, because the enzyme to convert the testosterone to estrogen is found in fat, and so the less fat cells you have, the less likely you will be one of those people who convert your testosterone to estrogen. There's a natural supplement called DIM, D-I-M, which you can take about 300 milligrams a day. DIM basically is like concentrated broccoli and what they call cruciferous vegetables in a pill, and that's a natural way to do it. It works somewhat. It varies in individuals. It does take a long time to kick in, but it has been shown to balance out estrogen levels, and so that's one way you can also fight your estrogen from being too high. Taking zinc, 50 milligrams a day, blocks the enzyme of the conversion of estrogen to testosterone, so you can take zinc, which you can get over the counter at any drugstore for 50 milligrams a day. But the most effective is prescription medication. Now, there are two types that I personally use. There are several types out there, but I personally use two types. One is called tamoxifen and one is called Arimidex. So tamoxifen is a medication that we prescribe. It's a medication that blocks the action of estrogen at the peripheral tissues. So basically, estrogen is built up in your body, but your cells won't be able to use it. And that's tamoxifen. Arimidex is different. So what it does, it just blocks the formation of the estrogen in the first place. Now, usually the best way to work this out or to handle this is if you are somebody who's at high risk for developing estrogen, say you have a high percentage of body fat, or in the past you know that you do convert your testosterone easily, that would be a situation where I would start you on tamoxifen for about 30 days and put you on Arimidex at the same time. So as your estrogen is getting blocked, your body can't use the estrogen that's already in there. Don't have to do that too often. Most of the time I just start out with Arimidex either from the very start, or we check your laboratory examinations, and if your estrogen is high, then we start Arimidex at that time. Arimidex, it's a dose of 1 milligram twice a week, which is it's basically half a tablet every Monday and Thursday. Sometimes, again, depending upon how you feel and if you're very in tune with the body, it could be every Monday or Friday, or every Monday or Wednesday. But in general, every Monday and Thursday is a good routine. These Arimidex tablets are tiny, so you have to crack them in half with the pill cutter, and then take half of it on Monday and half of it on Thursday. And then once you're on the Arimidex for a while, then we check your laboratory exams to make sure you're in that sweet spot of between 20 and 30, if that level works for you. So. And again, because we don't want you too low, because if we have you too low, then we can get those complications that I mentioned before. So I hope this answers, in general, your questions about Arimidex and the use of it in hormone replacement therapy or testosterone replacement therapy. If you have any questions, you can send me a question in the comment below, and I'll do my best to answer it. Or if you want to hear more about how we do it here at XSculpt, regarding hormone replacement therapy or any of our surgical services that you can see on our website, please leave it in the comments below, and I'll do my best to answer it either via email or messenger or on the comment section, or if it's a very good question, I'll do a video on it. Like everybody on YouTube says, click subscribe so you can see our newest videos, and I'll try to do this a little bit more often. So have a great day, and we hope to see you soon in our offices. Thanks.